More than 8,000 Albertans are sharing what they are calling healthcare horror stories as part of a new campaign from CUPE Alberta. Experiences range from long wait times and patients sitting and lying down in hallways. The provincial government acknowledges there is work to do and it's adding capacity. Tyson Fedor reports.
Elaine Bonfield is one of thousands of Albertans frustrated by the provincial healthcare system.
When you go in there, you're looking for hope.
Bonfield walked into South Health Campus 3 times in October complaining of severe chest pain. She says no investigation or pain management was given.
They told me I needed urgent scope, and I still don't have it. And that was in October. We're sitting in waiting rooms for 8 hours around other people that are, either really upset. There's violence in the waiting rooms. There's people that are vomiting beside you, children screaming. It's a very unsafe, scary environment.
Following that visit, she received a referral for a scope in December. It was deemed semi-urgent, but the wait time is between 5 and 10 months.
Those horror stories are just going to keep on going, and more people are going to have horrendous outcomes waiting in our waiting rooms.
Bonfield is participating in an online campaign launched by CUPE, which represents 44,000 employees in Alberta, including many healthcare workers. The union wants Premier Danielle Smith to declare a state of emergency on healthcare.
Every time we uncover a new problem, we solve it.
The Premier touted her government's new family doctors and a new nurse practitioner model as being a success.
There's no question more work needs to be done on the first point of access people have going into emergency room, making sure that people aren't parked in emergency treatment beds, that there are open beds so that if somebody needs to be an inpatient, that they're moved along, and that will change the experience people have.
Bonfield just wants to see more mental health support for patients and additional beds.
And I've also just lost hope at this point. I'm telling my family, we need to be healthy because I don't want to rely on the emergency systems or the healthcare system.
Tyson joins us from South Health Campus tonight. And Tyson, the state of healthcare here comes as it has been one of the deadliest flu seasons on record.
Well, Tara, latest provincial data released today show that 242 people have died from the flu this season, which began in August. The record was set last year at 236, so we have now surpassed that. However, Dr. Paul Parks, who you heard from in that story, says we've now passed the peak of flu season, so he's hopeful that it will alleviate some of the pressures here on the hospitals throughout the province. Tara?
Okay, Tyson, thank you.